Hello there, Dr. Mintz. I wanted to go through this case of an interesting situation. This is a middle-aged woman, 52-year-old woman with abdominal pain, came into the ER last night, and she has this big mass. Now, one thing you want to ask yourself whenever you see a big mass like this is where in the abdomen it might be located. And this is where we have to know our spaces. So basically, look at a big mass like this. You see that you describe its overall size. It's heterogeneous, so there are low attenuation areas in the mass, cystic areas perhaps. But the important question is where it originates, what organ it's arising from, what tissue. And here there are a couple of choices. One is that it seems up superiorly here, if you follow the pancreas here, the pancreas tail, body, and you follow toward the head, you come into this mass, so maybe it's pancreatic. On the other hand, you look here and you look in the kidney and you see that there's a big mass here. It looks like it's involving part of the kidney. The upper pole there looks okay in the kidney, then we'll go back down through it here, and the lower pole looks okay too. So maybe it's arising from the kidney. Well, one thing that can give you a hint here is the relation of the mass to other anatomic structures, and probably the most informative one here is the duodenum. So here you can see the stomach. And the stomach sweeps over here, and here you have the proximal duodenum, the first portion that goes over to the right a little bit, and then duodenum starts heading south. So it's superior-inferior orientation. So that's the second portion of the duodenum there, and then you can see the third portion sweeping across. So this tells you that the second portion of the duodenum is displaced anteriorly, and you would not typically expect that from a pancreatic mass. The kidney is positioned so that it could well produce anterior displacement of the duodenum. Also, if you look more closely at the pancreas, you can actually see that the pancreatic head is just displaced. So again, here's pancreatic tail, body, and then we get into the head area here. Now, if we go down a little farther, if you stay right in this area here, you see the big mass is squashing the pancreatic head, but this is actually a pancreatic head here, here. And you can even see this little lip of uncinate process sticking out from the pancreatic head there. And you see that best right here. So this is all pancreatic tissue, and so that you can actually see that the pancreas itself is intact. So it looks like it's renal. Whenever we see a renal mass, we want to look carefully at the renal veins, because often a renal neoplasm will extend into a renal vein and potentially up into the IVC and farther. But here we can see the renal vein pretty well coming into the inferior vena cava. Here you can see the left renal vein and the right renal vein, and you can usually tell the renal veins partly because they're larger than the renal arteries, but the most reliable clue is that they connect with the inferior vena cava. So it is that type of anatomic relationship that really determines whether something is arterial or venous. So always look for that rather than simply their size or what they look like. You want to make sure you know what a vessel is connecting to before you give it a name. Now around this mass you also have a fair amount You have a fair amount of stranding, which is inflammatory, probably, or maybe some infiltration by the mass. This is important because this is how tumor may extend. Now, I want you to understand the spaces. Now, this is the anatomy that is important because you have kidney, and around that you have perirenal space, and then around that you have pararenal space. Remember, you can't see the margins in this particular case well, but around the kidney immediately is perirenal, and then anterior to that is anterior pararenal, and posterior to that is posterior pararenal. Usually you see a nice defined fascial plane, but we don't see that here. All of it is retroperitoneal, though. So the portion of the duodenum that's displaced here, the second portion of the duodenum, is retroperitoneal. The pancreas is retroperitoneal. The kidneys are retroperitoneal. The abdominal aorta and IVC are retroperitoneal. So it's important to understand the anatomy because it will help you identify where the structures are arising and what kind of abnormality you're dealing with. So knowing these spaces is critical here. So this is a retroperitoneal mass arising from the kidney and extending up and displacing the duodenum. Interesting case. Now here is, let's see what else we can get here. We see a nice normal looking appendix. And you should be comfortable, start getting comfortable looking at cases and identifying which part of the colon you're looking at. In this case, the colon has a number of diverticula, but you should be able to follow right colon up to hepatic flexure across transverse colon to the splenic flexure, and then down the left